You're welcome back. Once again, this is Health Matters. The number to call for your reactions is 012206-842. That's 012206-842. In case you have questions, comments, or some things you notice. And then we'll go on with the topic with Dr. Igwe. Dr. Igwe now, are there any procedures that are carried on the thyroid as a means of treatment or addressing the situation of hyperthyroidism?
Procedures, yes. But before you talk about procedures, anybody who has features suggestive of hyperthyroidism or hypothyroidism, for that matter, will need to get assessed first. So when the person is assessed by a doctor, the next step will be to make a diagnosis, and the question to answer is the thyroid hyperproducing? Is it hyperthyroidism that will explain the symptoms that this person presents with? Because there are many things that could also mimic that. When a young lady reaches the typical age in which the people with thyroid disorders comes to the hospital losing weight, excessive sweating, anxiety, you would think of a thyroid disorder, but there might be a few other things that can cause that. So with that suspicion, requests can be made of thyroid levels in the blood. And those thyroid levels are easily analyzed in many labs around. So after the analysis, the question will be answered: does this person have excessive thyroid hormone production, or is there any abnormality? After that, the next step will be to find out what is causing it, because like I said earlier, it could be from excessive intake or excessive production. Usually that may be obvious. There may be an anterior neck swelling from a goiter, which is...
Yes, that neck swelling, what really causes it? Too much hormone or too little?
The anterior neck swelling is not really caused by the level of the hormone. Some people have an anterior neck swelling from a thyroid gland, which is what we call a goiter, from just an increase in the size of the thyroid gland. And this increase can just be, in many people, is silent. What we mean by silent is that the neck is increased, but there is no hyperproduction nor underproduction of the thyroid hormone. Because of that pituitary regulation, the thyroid gland is enlarged, can be very big, but the production, the output level is about normal.
But why would there be a swelling? It looks abnormal. Isn't there a way of not letting this swelling happen? What is the body responding to by swelling at the, by the gland swelling?
This swelling sometimes can occur. I talked about iodine earlier. Iodine deficiency is a common cause of this goiter.
And you said iodine is what the gland uses to produce the hormone.
Yes. And this iodine deficiency as a cause of goiter is a sort of compensatory mechanism, because the thyroid gland needs iodine to produce thyroid hormone. And when there is iodine deficiency, the organ tends to increase in size so that to be able to mop up more iodine from the blood, because it needs more iodine than other organs.
Isn't that why we have iodized salt?
Yes. So iodine deficiency used to be a very common problem worldwide, but these days it's not as common as it used to be. From interventions from WHO and other organizations, NAFDAC has really gone a long way to help it. The late Dora Akunyili, Professor Akunyili, God bless her soul, was very instrumental in making sure that Nigeria, the level of iodine in most Nigeria food is normal.
Do we iodize other things besides salt? Is it possible?
Yes, we get iodine from some other food materials like bread,
Okay.
and even from water. Iodine, so
So those are put in deliberately into water, into bread,
into
into salt.
water, maybe not deliberately, into bread, yes. Different countries have different food materials that they add iodine supplement to. So if bread is a very common food consumed in a certain country, they may decide that
They should
from a
iodize
policy
it.
of the government, they should iodize bread so that as many people as possible will have normal iodine supply. But normal water, normal tap water also has iodine. Tap water streams have iodine that
Do we
seeps from
have
the...
any food sources of iodine, naturally occurring iodine in food?
There are some natural sources of iodine in food, but it's commoner to have sources of what we call iodine antagonists. There are some substances that...
Okay, we're going to come back to that in a minute. Christopher is calling from Lagos. Hello, Christopher. It looks like we lost Christopher. We're talking about the iodine sources.
Yes.
We don't have it occurring like, for example, let's see, the way we say you get protein from milk and meat, you get vitamin A from carrots. Don't you get iodine from a food source?
The iodine we get from salts from this is actually enough for our daily need. The daily requirements of iodine is so little that if we use iodized salt, we are likely to have enough iodine in the body.
But some people, now I'm talking particularly in Nigeria now, you said they iodize other food substances in other countries.
Yes.
Some people have been asked not to use salt, for example, high blood pressure patients. What do those ones do if they need more iodine?
They have not been asked not to use salt. Everybody is advised to limit the amount of salt consumption. And the recommendation is not only for those with high blood pressure, also for those who do not want to have high blood pressure.
I know a couple of people who
means
don't take
everybody.
salt at all because they're so scared that their blood pressure will skyrocket.
No, the recommendation is to limit the salt consumption from all sources, from added salts, from our Maggi or whatever we use to spice up the food. And some will recommend 2 to 2.5 grams of salt per day, and that has enough iodine for our daily need.
Okay. Yet some people still don't get enough, and that's why they have the swelling.
People who do not get enough, sometimes it also arises from the geographical location. There are some people who live in mountainous areas. Like in Nigeria, you get the neck swelling more commonly in people who live in hilly areas like Enugu and some states.
Okay.
Because of the topography of the location, the water is as if the iodine on the soil, which is a natural component of the soil, has been washed off. So the source of water supply doesn't have enough iodine from them. That is one explanation. Then there are a few other explanations for people who have these neck swellings. We call them endemic goiters, goiters that are very prevalent in those particular locations. They may also include the fact that we talked about family, so clusters of families with
the condition
in the same area. Then there are some other food consumptions that interfere with the normal utilization of iodine from the body. There is enough iodine from the diet, from water, but those food substances makes it difficult for the thyroid to take up iodine.
Okay. Now, if you were to treat cases of hyperthyroidism, hypothyroidism, would the person involved be able to act normally, and will the person lose all those symptoms, sweating, discomfort, palpitations, intolerance to temperature. Does it correct the situation? In essence, that's what I'm asking.
Usually, most of those symptoms are correctable. In fact, in most of the people, all the symptoms can resolve within a few weeks or months, depending on the amount of drugs consumed, individual adherence to the treatment, and a few other things. Some of the symptoms, in fact, can correct within a few days, like the excessive shaking, the sleep, the excessive sweating. Then the weight will take some time to come back. But there are some of the features that may be more difficult to reverse. They can be correctable, but if they've been there for a very long time, they may take some time to reverse or may not reverse. And those include some heart complications.
Okay.
Because hyperthyroidism can cause the heart to get bigger. And usually when you start treatment, it can correct. The other one that is a bit more problematic includes the eyes. One of the features could be bulging eyes.
Okay. And that is not very easy to correct.
It is difficult to predict whose eyes will get back to normal when you start treatment. For many people, when you start treatment, depending on how big it is or for how long it has been, it can get back to normal.
So picking up from what you said, I guess the answer is come in time, report early.
Yes, that is a message here.
I'm afraid we'll have to stop there. Thank you so much for coming to the show. It's been wonderful having you.
Thank you.
Thanks for being with us. I'm so glad to have you. We are so glad to have you on the show. It's a pity about the calls. Next time. Have a great day. I'm Mary Alale Yusuf.